It's
I'm not
3
seeing
minutes.
you.
It's 3 minutes past. I think we better start.
We better start, yeah, okay. Okay, welcome to this webinar to raise awareness of COVID-19. Welcome, gentlemen, and all the participants, and our distinguished ladies, and all the participants, women participants. My name is Dr. Peter Julu, your moderator for today, webinizer. I'm a specialist autonomic neurophysiologist and a consultant physician, and I have a honorary consultant position with the Bath and National Health Service Trust. And I'm also a senior research fellow with the Queen Mary University, London. But this webinar is not about me, and it's mainly about you, the participant, to raise awareness of COVID-19. And our organizers are two. We have on the left side the Diaspora Health Strengthening Partnership, DSSP. DSSP is a charitable organization limited by guarantee and is registered in England and Wales. It was actually formed in 2017 in response to a call from Health Education England and Global Health Engagement, also within Health Education England, who are very much in need of assistance in strengthening health system in northern Uganda. DSSP is run by a steering committee, and it draws its membership from Ugandans in the United Kingdom and abroad. These are members who actually possess healthcare administrative and governance skills. The partnership therefore brings together experience from education, public health, and international development, and it works with healthcare-based institutions in Uganda and in the United Kingdom to develop and deliver really intervention and also to strengthen the health system, primarily in northern Uganda, but this can be upscale in the whole of Africa. So this is DSSP. Meanwhile, on the right side is Bobby Welfare Association, which is also a Ugandan community charity registered in England and Wales. And I would ask Dr. Chelam to introduce Bobby Welfare very, very briefly.
Yes, Dr. Chelam Udong.
Yeah.
Retired general practitioner who has lived and worked in Luton for the last 23 years. Prior to that, I was a gynecologist. Now, Bobby Welfare Association came as the need for cohesion among the people who claimed descendancy, and also through marriage and association that came together to look after our welfare in the face of very difficult times in northern Uganda. In fact, we came together in the 1990s, but only became registered as a charitable organization in 2005. And as the name states, we really try very hard to look after the welfare of our own people. And this has been on the charitable side of things. We support each other in, in good times and bad times. And also, over the years, we have raised awareness of health issues within our own community and try to educate our own people. And some of you may have actually attended, the actual community may have attended some of the lectures that we carried out in the London area. This has been 1 or 2 every year for the last 10 years. Last year was the only year that we've not been very active. I think I'll leave this very briefly and hand you back to Mr. Julu.
Yeah, thank you very much indeed, Dr. Chelam. Now I have to introduce you to our eminent panelists today. We have Dr. Alfred Banya. Can you greet the participants, please? Dr. Alfred Banya is a deacon.
Yes, would you like me to Are you introducing me or just you? Would you like me to say
I'm
something?
introducing you. Yes.
Right. Okay.
Yes.
Okay.
I just wanted you to wave your hand.
All right. Yeah. Okay. I've waved my hand up. Can you see me?
Yeah.
Yeah.
Yeah. Okay. Dr. Banya is a deacon in the Catholic Church and head of chaplaincy at King's College Hospital National Health Service Trust in London, here in United Kingdom. Dr. Banya obtained a degree in medical parasitology from London School of Hygiene and Tropical Medicine. And he went back and taught very briefly medical parasitology at Makerere University. He came back to UK and obtained doctorate degree in the healthcare research from Lancaster University. He also holds a degree in healthcare ethics, theology, and care in general. Dr. Banya worked with South London Borough as an assistant director of public health before he retired to take up a pastoral ministry as a deacon. Dr. Banya. Our next panelist is Dr. Caesar Joseph Achaye. Can you greet the participants, please? Dr. Achaye is a specialist doctor in a medium secured unit in Birmingham, here in United Kingdom. He's working with people with enduring mental illnesses requiring enhanced rehabilitation. Dr. Achaye obtained his medical degree from Makerere University, Kampala in Uganda in 1982. And he came to UK and obtained a diploma in tropical medicine and hygiene from Liverpool School of Tropical Medicine. He went on to obtain a master's degree in tropical medicine with a focus on epidemiology of tropical infectious diseases. The epidemiology really is important here, especially of infectious diseases. So that talent is needed here. He also obtained a master's degree in biotechnology, including molecular biology from Bristol University. So that's another skill that is well required, molecular biology, as far as COVID-19 is concerned. Dr. Joseph Achaye. The next panelist is Dr. Charles Ashela-Modong, who have just introduced himself very briefly. You have already seen him when he was introducing Bobby Welfare. Dr. Achelam is a retired general practitioner. He obtained his medical degree from Makerere University in Kampala in Uganda in 1976. He then obtained his membership of the Royal College of Obstetrics and Gynecology in London in 1983, when he went, but unfortunately he went to practice in Saudi Arabia, not in UK. Dr. Achelam came back to UK, however, in 1988, and after a very brief practice of obstetrics and gynecology, he decided to go back to basics and became a general practitioner in 1996. He trained under the Joint Committee on Postgraduate Training for General Practice within the Royal College of General Practice. Dr. Achelam retired in 2019, very conveniently, just before COVID-19. Dr. Achelam.
Thank you.
So I should introduce you to our first speaker. Our first speaker, whom you are going to be, hearing for at least 1 hour, is Dr. Christopher Nyeko. Dr. Nyeko is a specialist psychiatrist with Kent and Medway Mental Health Trust. He is a community psychiatrist dealing with referral from general practitioners like Dr. Achelam and the rest, the police, the courts, and other community agencies. He is also a medical educator involved in training postgraduate doctors, medical students, and nurses. Dr. Nyeko is actually our son from Uganda who obtained his medical degrees from Makerere University in 1981. He then came to United Kingdom and obtained a postgraduate degree in human and applied physiology from King's College, London, here in UK. He continued pursuing a medical career and obtained a diploma in tropical medicine from London School of Hygiene and Tropical Medicine. He went ahead and obtained a Master of Science in Medical Informatics and a PhD in the study of physiology and psychology of human feelings. He did his membership courses for Royal College of Psychiatry at Oxford University. Now, Dr. Nyeko will give us a lecture on COVID-19 and mental health. We hope he will really give us an insight into how the lockdown, bereavements, and other effects of COVID-19 and how it's going to how it affects the diaspora community. Dr. Nyeko. I need to go to full slide.
Yeah.
The slides to show are right down there. Yeah.
Put on full screen.
Yeah, full screen. Yeah, there you are.
Okay. All right.
Good.
Okay. It's good afternoon, all the attendants, all the panelists, the moderator. As the moderator introduced myself, I'm Dr. Christopher Nyeko, specialist community psychiatrist. Before I became a psychiatrist, I was a surgeon. I trained and practiced surgery at St. Thomas's, London. Went to Aberdeen, and then went to Ben John's in Cornwall. Then I came back to London. I was still a surgeon. But then I got news that there's a lot of mental health cases, especially of our people in London, and then our people at home. At home, that time, people were in camps due to the war situation. Then later, Ebola came. So all these situations increase cases of mental health. And also not on our people, worldwide, mental health has become almost another pandemic. Almost any other person, every other person has gone through some mental health problem. So I switched from being a surgeon to being a psychiatrist. And since I've been a psychiatrist, I've enjoyed it because it's very fulfilling. It's very, you see the problem which you can also identify with, and also the help I can get and give. Okay. Now, let's remember, just earlier this year, not long time ago, we were still very happy compared to now. There was no social distancing. There were no wearing masks. There was no, you could gather, you could go to the markets, whether here or in Uganda, without any you just go and negotiate. You meet your friend on the streets, you rush and grab his hand and greet. But that seemed to be a thing of the past. But we hope we'll go back to that time. Okay, so what happened? That is the enemy. He looks big, but it's invisible to the naked eye. You can't see it. this one is magnified thousands and thousands of times. It's only seen under the electron microscope. So this is what we know as the enemy causing us all these problems. In Swahili, it's called adui. At home there, we call it gemo, because gemo, you don't see it. You only hear about it. So that is the problem with COVID, because you don't see it. There are still a lot of people who believe that this COVID doesn't exist because they want to see it. Now, we are aware of the damages it has been causing to our health, to the deaths, to the employment, to the family. So the consequences make us believe that COVID-19 exists. Now, I work in the community team, which is composed of doctors, nurses, psychologists, social workers, support workers, managers and admins. Now in our team, all are of equal significance. The other group of people who we rely on heavily are the clergy, which is the spiritual. So, because we work in the community, some of our patients are referred by the clergy. By the clergy, I mean the priests, the reverends, the pastors, the imams from the Muslim, and then from the Hindus, from the Jews, from the Sikhs. So we get a lot of referrals. So we work in conjunction and we work in partnership. And we also refer some of our patients for pastoral support. So we work together. Now, our team, we do what's called mental health assessment. Now, you might be referred, either you refer yourself or referred by your member of family or referred by your GP or referred by the police. Now, I have to briefly talk about mental assessment, because a lot of people, when they come to us, they actually don't know what to expect. Because when you hear psychiatric assessment, the question is, am I mad or not? Or a lot of them are very anxious because they don't know what a psychiatric assessment is. But now we don't really talk about psychiatric assessments because all these team members do the same mental health assessments. So the doctors, the nurses, psychologists, social workers, support workers, they all are able to do. So it's not only the psychiatrists. So the all members of the team can do a mental health assessment. Now, in the assessments, we usually take about 1 hour, the first initial assessment. So you expect to be asked about your childhood, your teenager years, your time in school, how you are at school, your adulthood, your education, from primary to whatever level you have reached, your employment, But I must emphasize that all this information is voluntary, but most importantly, that it is confidential. You don't share it with anybody. You own the information. Now, we also ask about housing, because housing is very important for mental health. We also ask about your relationship with friends, within the family, you are married, with your children. As I mentioned before, but this is your voluntary. You can talk about your belief, your spirituality. So if you need some spiritual help, then we can signpost you for this help. Now, this is sort of the history of it. But also briefly, we talk about the mental state examination. This just means how you appear, how you behave, your moods. Are you sad? Are you happy? Are you excited? Your speech, your normal volume, tone, your thoughts, and your perception is, because some patients hear voices, they see things which other people don't see. Now, on the assessment, we also do physical. So the standard doing blood pressure, temperature, and tracing of the hearts. But now, because with COVID, we also assess everybody for COVID, so that we know whether you have COVID symptoms, and if you have done a test, if it is positive, negative, or you avoid infection and you are recovering, so that you are offered supports with COVID. Now, after all these assessments, we now have individualized care plan. Because after all this information, the care is targeted to your need. Because not everybody will have the same need. So your care plan will be targeted to that plan. Okay. Now, community team development. Over the recent years, it become important and placed, what has been placed on community mental health services to avoid hospital admissions. Because research has shown that people, when they're outside in the community, they tend to get quicker improvement, and also it allows patients to stay in their homes so that they're able to continue to work with their employment, and also with the appointments. Actually now when we can do appointment on the phone, you don't have to keep time of work. You can continue with your work. You just get maybe 1 hour, get your appointment, and that's done. And you also can continue with your daily activities in the community while on treatment. Now, non-reactions to COVID. I must say, anxiety is not necessarily a bad thing. There's good anxiety and bad anxiety. Now, good anxiety, you know, for all of us, or most of us have done exams. Just before, you have some anxiety. But that anxiety is helping you to work hard so that you're able to perform better. Or you were going for a job interview, that anxiety before the interview, it gears you up so that you're able to perform during the interview. Also, for the young boys and young men, when they spot the girl they're interested in, it's a beautiful girl, you see that the heart is pumping. And he doesn't have the courage to say, to ask her out. But he approaches the girl, the heart is pumping, he is sweating, the words are not coming out because of dry mouth. But the girl just look at her and say, oh, you look so vulnerable. So in fact, it works. So these are good anxieties. It makes you perform. But, and also during the COVID, most of us were anxious. So we make sure that we followed the rule by wearing masks, wearing gloves where necessary. So these sorts of anxieties make you perform and follow the rules. But when they become abnormal, that's when you can't perform. So that's when we talk about negative responses. So in this situation, when it comes to COVID, there could be excessive anxiety and fear, which can result also with depression. And there has been a lot of increase of suicidal thoughts. Now, these suicidal thoughts can be a negative and can be risky and dangerous. So we'll come back to that later. But also, there's been a lot of bereavements and the aftermath due to COVID. Because we have seen a lot of deaths, there's a lot of bereavements, but also because COVID was a sudden thing, it destroyed a lot of people's plans. Because early this year, from about February, most of us didn't expect what has happened. So it's only from March, April that the danger came out. Now, the lockdown also affects people, and it has caused a lot of verbal and physical aggression and domestic violence, because a lot of people react differently to this sort of environment where people are stressed out, fearing is the unknown of the outcome of COVID. And also one of the effects of lockdown is inactivity. Because normally we wake up in the morning, we dress up, go out to work, and no problem, then we come back in the evening. But because of this lockdown, we're locked out in the house. And maybe most people now work from home, and then you are surrounded with food. So there's inactivity and increased food intake. That results into obesity, diabetes, hypertension. But also, one of the negative effects of COVID is the emotional, physical, and sexual abuse. That one also, unfortunately, there's been a lot of increased incidences of emotional, physical, and sexual abuse. Now, COVID-19, there has also been 20% of those infected with COVID-19 have been diagnosed with psychiatric disorder within 90 days of diagnosis of COVID. So as is mentioned before, the effects has resulted in increase in mental health problems. And most of them are anxiety, depression, and insomnia. That's lack of sleep. Now, Oxford University researchers also found there's a higher risk of dementia, either due to causes of affecting the brain directly or indirectly. We'll come back to that. From my own experience, because I work in Kent Community Mental Health Services, but we also link up with Maudsley, which is the South London. From March, my caseload has doubled since COVID. And there's been a lot of increased suicidal thoughts and some very serious attempts. That's a direct result of COVID. Now let's talk about a little more in detail about this. We talked about anxiety and depression. Now we need to know that depression is a mental health problem characterized by low mood, a loss of interest and enjoyment in ordinary things, and a range of associated emotional, physical, and behavioral symptoms or problems. Now, depressive or depression can vary from mild, moderate to severe. Now, also, anxiety, the generalized anxiety disorder, which is always characterized by persistent and excessive worry. This worry is not the normal, because all of us worry about something. But if it becomes persistent and lasts for over 2 weeks constantly, then that's when you might need professional help. And you have difficulty even controlling your worry. This is the physical bit accompanied by restlessness, difficulties with concentration, irritability, muscular tension, and disturbed sleep. Another type of anxiety is social anxiety. It's called social phobia, where people tend to now isolate because they now don't want to associate with people. So it's characterized by intense fear of social or outperform and distress, and then the fear ability to function. So they will do anything to avoid social situations, and they feel negative that they're being judged by other people, and they feel embarrassed or humiliated, and they fear situations and avoid or endure. So even thinking about going out brings intense anxiety. And this, due to COVID, unfortunately, that has increased. So a lot of people now, even when the lockdown is lifted, they don't want to go out. Now, the other one is panic disorder. Panic is as a result of repeated unexpected attacks of intense anxiety accompanied by physical symptoms. So there's a marked fear of future attacks, and this can result in avoidance of situations that might provoke panic attack. So even thinking about the situation, they go into panic attacks. Now, the other one is agoraphobia. That is fear. It's a part of this one. They are permanently inside. the house. They don't go out at all. And I know some of our patients who have been, they haven't gone out for more than 2 years. They haven't gone out even for the corner shop. Yeah. And the other situation is obsessive compulsive disorder. These are people who constantly cleaning, constantly checking things. They feel very insecure. And all this have increased due to COVID. Now, these are mood disorders, but also there are personality disorders, which is the most common is emotional unstable personality disorder. These are mainly from childhood, due to traumas in childhood or in relationship. They grow up not trusting people. They because of the history of the traumas, so they are not trusting anybody, even their own parents. At the end, they don't even trust themselves. Now, the other category of diagnosis is psychotic disorders. These are disorders which are the main problem is about thoughts, what we call thought disorders. Now, their thinking is not in line with the common thoughts. So they might think whatever the TV is saying is talking directly to them, is personal to them, or they might have some delusional ideas which the ordinary person will not understand. And those are the thoughts. But also part of other psychotic symptoms is what is called perception abnormality, which is hearing voices, seeing things. Now, these voices is the only ones who hear them, or things which they see, which other people don't see. Now, our advice now is, because in the past, they used to be criticized, but for people who are caring after them or their friends, because to them, they believe it's real. So just criticizing them and saying, no, doesn't help. So you need to reassure them, say, yeah, I'm sure it's what you're seeing is real to you, but I'm not seeing it. So you are not agreeing, but yet you are recognizing. Now, the other one is dementias. Dementias, as due to COVID, there are two things which have really happened. One is increased presentation of dementias. And the second one is the difficulties of coping with people with dementia, because they are now isolated. They are mainly elderly people who are isolated, either in their own houses, and they are not visited by their grandchildren or their children. So they are in a particularly difficult situation due to COVID. The other group are childhood disorders. This is autism or ODH, that's attention deficit hyperactive disorder. These are children who, over the years, there's been good development in that they are now being educated in the mainstream education system. Because in the past, I'm talking about many years ago, they would be in special schools. But I think that is now being discouraged. So that they are not isolated. They are being now being educated in normal stream education. So they are now, at least through the system now, they have not been isolated. But still, because of COVID, this particular group are affected even more than the other groups. Now, the last one which I considered is organic disorders. These are commonly due to either infections or metabolic situation like diabetes or other strokes. So in this talk, organic disorder, the main one is COVID currently, which has caused a lot of distress. So a lot of anxieties, a lot of suicidal thoughts, and even the ones who are psychotic has got worse because of COVID. Now, we go to our MOT. MOT is mainly done on cars. So every year, if you have a car, every year you need to do your MOT. Check the engine, check the oil, check the tires. So the physical MOT is mainly your GP will encourage you to doing regular blood pressure, regular pulse, blood test for cholesterol, and so on. But now we have our own MOT in mental health. These are ones which you can do it by yourself. So you can do it confidentially, just be honest with some of the questions, and then assess by yourself and see what your MOT in mental health, how it is. Now, absorption-free aspect which you can do on yourself, and there's a website there which you can download. You can download and you assess it yourself. Now, the first one is PHQ, which patient health questionnaires, 9. 9 just means there are 9 questions, and each of them will give you 3 grades. So, for example, at the beginning, it said, over the last 2 weeks, how often have you been bothered by any of the following problems? So the first question will ask you little interest or pleasure in doing things. So in the last 2 weeks, have you had little interest or little pleasure in doing things? Now it will grade you from 0. 0 means you're okay with that. At several days, so say 1, more than half the days, say 2, nearly every day, that will give you 3. So there are 9 questions here, which I'm just reading them for your information. But afterwards you can download and then assess it for yourself. So the second one is about feeling down, depressed, or hopeless. And the third one is trouble or staying asleep or sleeping too much. And 4, feeling tired or having little energy. And number 5 is poor appetite or overeating. And number 6 is feeling bad about yourself or that you're a failure or have let yourself or your family down. Then number 7, trouble concentrating on things, that is reading the newspaper or watching television. Then number 8 is moving or speaking so slowly that other people could have noticed, or the opposite, being so fidgety or restless that you have been moving around a lot more than usual. And the last one thoughts that you would be better off dead or hurting yourself in some way. Now, all these are graded, and then you do the total, and the score. If the total is 0 to 5, that's mild. That's 6 to 8, that's moderate. 11 to 15, moderately severe. 16 to 20, severe depression. But I must say, this is a screening tool. It's not for diagnosis. So it's just giving you a general idea. If you feel, for example, if you got 16 to 20, and it's saying most likely talking towards severe depression, now you need to ask that professional assessment to verify. Now, the next one is about anxieties. So another MOT for anxiety. So guys, that's 7. That means 7 just means there are also seven questions. So the assessment for anxiety. Now it also says, over the last 2 weeks, how often have you been bothered by the following problems? Feeling nervous, anxious, or on edge, not being able to stop or control worrying too much about different things, trouble relaxing, being so restless that it's hard to sit still, becoming easily annoyed or irritable, feeling afraid as if something awful might happen. So this is sort of question which can happen to any of us. So when will show you the grades from 0 to 3 for each, then you total it at the end, and then you get the scoring. So the scoring will show you what's, so it's also similar to the one for the depression. So it's also from 0 to 5 is mild, 6 to 10 is moderate, 11 to 15 is moderately severe anxiety, and 15 to 21 is severe anxiety. Yeah, the last. The last one is about work and social adjustments. These are self-adjustment for doing day-to-day tasks. These are also graded in a similar manner, but these are with people's problems sometimes affect their ability to do certain day-to-day tasks in their lives. To rate your problems, look at each section and determine on the scale provided how much your problem impairs your ability to carry out the activity. This assessment is not intended to be a diagnosis. If you are concerned about your results in any way, please speak with a qualified health professional. So this one is, so there are five questions. Assessing your ability to work, ability to do home management, that's cleaning, tidying, shopping, cooking, looking after almost children, paying bills. And there are the social leisure activities. And the first one is private leisure activities. And then number 5 is close relationships. So if you go through this one, it shows you the how you are with your day-to-day activities. So these are the 3 MOT tools which you can use for screening. So if you have any from how much you scored, then you can you can self-refer for assessment and help. Now, this professional help is required when you need assessment for dementia and psychosis, because this might need specialist assessment and help. Now, once you have done your MOT assessments, you find that there are some things which you need help with. There are contacts in England which are very more than willing, especially now with this COVID, that they need support for people when they need it. Now, there are telephone numbers available on internet for these services. So community mental team, like where I work, but also crisis team and home treatment team. Now, if you're in a crisis, the crisis team can treat you and come and treat you at home. But there are also other help lines like mental health helpline, housing, and homelessness. So there are help for that. And then we have the Samaritans, you have talking therapies, domestic abuse. As I said before, because of COVID, there has been a lot of domestic violence. So now you can just go on the internet, and every region has domestic abuse helpline, and also refuge for partners who are being abused. So in a crisis, they can be having place where they can be given refuge. There's also alcohol and substance misuse services like AA, and then some professional alcohol services. Now we need positive actions. All of us are now aware of hands, face, space, washing hands, wearing masks where we need to. The second one is equally very important: exercise and healthy eating. Because of the lockdown and the limited movement we're having these days, we need to be smart in what sort of exercise. And you don't need equipment to do exercise. Just stepping and running on the spots in your own house, that is equally good. Now, healthy eating is equally important, like exercise. So we need healthy eating, we need vegetables, we need fruits, we need cut down on sugar, cut down on some spices, so that when we also boost our immunity by taking vitamin D and vitamin C. Now, vitamin D, especially for all of us who are from Africa or in Europe, we inadvertently, because we are covered up, there's not a lot of sunlight, because vitamin D is actually made on the skin. When the sunlight comes to your skin, then the vitamin is made. But because we're all covered up with lack of sunlight, most of us, surprisingly, are actually having low vitamin D. So when you have low vitamin D, your immunity is also lowered. So if you have infections like COVID, you are most likely to have a poor outcome. So advice now is for everybody, but especially the blacks, to be taking vitamin D and the other vitamins. The other one is loneliness. So now, because We don't meet physically with people, with our friends. So we now need to work smart with WhatsApp, with Zoom, with phones, with text. So that in a way you're communicating with your friends. So the more you communicate, the more you're avoiding isolation and loneliness. Now, the notice that there's no health without good mental health. It is because the government has made a program now to improve mental health, because without good mental health, we have poor health generally. Now, in layman terms, mental health is how we feel in our minds. So mental health is how someone is feeling in their mind. Now, good mental health is about feeling good about your life and being able to cope with problems when they happen. So when you're feeling good, you are most likely able to cope with problems when they happen. Now, mental health can be a problem in someone's mind. That makes it difficult to live a normal life. The problem with mental health is that your friend or your family cannot see it. It is in your mind. That in itself is very isolating, because people don't understand it. They don't see it. They just see the outside of your body, but they don't know what's happening in your mind. So that can be very lonely and distressing. Now, when you wake up in the morning and just say, I'm feeling good, that in itself is upbuilding, is upbeat, you're optimistic. The day is good, so your outlook is good. But if you wake up in the morning and, oh, what a horrible day, I can't do it, that is defeating in itself. So when you have feeling good in yourself, you're able to cope with problems, because problems are going to be there. They're not going to go away. So the problem can be small or more serious and can last. Now, the way forward. Now, people with mental health can often live normal life and go on with normal work. For example, a lot of professors, doctors, lawyers, teachers, nurses, politicians, technicians, laborers, they all have mental problems. But they are able to cope and continue to function. Now, as I said before, this increase in mental health now in the community. So now, 1 in 4 or 25% of the population experience mental health problems in their life. And I'm sure this percentage has gone up because of the COVID. So this figure is before COVID. So now after COVID, it's definitely going to be higher. Now, another very significant thing is stigma. Now, stigma, what are you mudong chen? Yes, give the water. That in Luo means the monkey following from behind laughs at the tail of the monkey in front. So because you don't think you have a mental problem, you sort of laugh at the one who's having mental problems, not knowing that you also have your own. So we know that stigma is very dangerous because it makes people stop looking for help. It makes people very isolated. It makes people distressed. It makes people give up. But we always advise people with mental problems to learn to cope with stigma. Because unfortunately, although stigma is getting more reduced, but it's still there, it still exists. So we encourage people with mental health problems, first, to get help, to get treatment. So when you get treatment, you can get relief from, for example, low self-esteem. So treatment doesn't mean medication. Treatment can mean counseling, other forms of therapy to boost your self-esteem. Secondly, don't let stigma create self-doubt and shame on you, because the person who's stigmatizing you is not, you are not the problem, they are the one who's the problem. And three, don't isolate yourself. Get support from families, from friends, from the clergy, from the pastors, from the priests, from the imams, from the temple, and the Hindus, the Sikh. So this is sort of groups which can support when you feel you are being stigmatized. And also when you join groups. The fifth one is don't equate yourself with the disease. Don't say, I'm bipolar. Because bipolar, you are not bipolar. You have bipolar, but that doesn't make you become bipolar. So don't equate yourself with the condition. And lastly, but also importantly, is speak out against stigma. Either speak out in the social media, on the internet, by text, so that because if the more we speak out, the more we can handle stigma. Now there are helps available for all. There's psychology, there's self-help, CBT. Now, CBT, this is a form of counseling, which you can be doing. You can do it by yourself online, or it can be done by a professional by phone. Now, CBT is based on the concept that your thoughts, feelings, physical sensations, and actions are interconnected, and that negative thoughts and feelings can trap you in a vicious circle. Now, CBT, which just means cognitive behavior therapy, aims to deal with overwhelming problems in a more positive way by breaking them down in smaller parts. Because when you have a problem, you might think it's too big. Instead of dealing with it at a go, break it into small bits. So you handle it. It makes it manageable. You are also shown how to change these negative patterns to improve the way you feel. So unlike other talking treatments, CBT deals with your current problems rather than focusing on issues from your past. So, because a lot of people don't want, oh yeah, when I go for counseling, they always talk about my past and so on. But CBT, we don't talk about your past. We talk about what's happening now how you're dealing with the problem now. How are you going to show you how to cope with the problem? Because some people, although sometimes some therapists you deal with the past, but with CBT is ideal for people to cope with the current problem. So a lot of people have taken it up because of the COVID also, how to cope with anxiety to COVID. So the current. We also have medications, variety of medications, which can be prescribed by health professionals. We have housing. As I mentioned before, housing is essential for mental health, because once you're homeless, that in itself is a stress in itself. Employment. Now, part of our, in the unit where I work, the patients who are showing recovery, we also make sure we encourage them for employment, facilitate them for employment, and some people employ them in our unit. So they become support workers, they become therapists, they become medical students, because these are the ones who have recovered. Some of them had very serious conditions, but since they've been recovered with us, we encourage them now to go for employment. So also encouraging social network, that helps with isolation. Now, most people with mental problems are to be treated in the community so that they continue to stay in their homes, continue with their work and employment. Now, very few people might need hospital treatment. So most people.
Just 1 month. I'm not taking. I will take some of them.
Now, treatment options, as I mentioned before, CBT, which I've already talked about. Spiritual support. Now, this is becoming more and more relevant. It's not only because of COVID. Recently, in a few years after, the Royal School of Psychiatrists, they're opening a new specialty about spirituality. So doctors, nurses, and other healthcare professionals can specialize in spirituality in connection with the clergy. Now, this group is called Spiritual Special Groups, which are based at the Royal College of Psychiatrists. They have regular seminars. Now, spirituality and religion, this is more, spirituality is more general than religion, because it can mean different things to different people. But from community mental health, we are all more interested in the positive results of spirituality, because research has shown that religion and spirituality develops inner strengths, peace, hope, and optimism. So people who have inner strengths, peace, hope, and optimism have better outcome in mental health. They can also help them manage stressful life events and improve their mental health. There's a website where is spiritualitymentalhealth.org.uk, where you can get more help and support. Now, medication, of course, there are many pharmacological agents which your doctor is best prescribed for you. Okay, recently also we have physiological treatments, transcranial magnetic stimulation which has been now approved in the United Kingdom for depression. But in America, it's now approved for bipolar, borderline personality disorder, post-traumatic stress disorder, obsessive compulsive disorder, and depersonalization. Now, this one is a magnetic. It's not electric. It's not like ECT where we used to use in the past. This is a new, which is almost that has no side effects. It's put on the outside the skull from outside. It's sort of a coil, a magnetic coil, which has been shown to improve depression and also improve cognition in dementia. So these are quite promising. There's mental health and physical health. There's interaction between mental health and physical health, which I mentioned before. Because of lockdown, there's increased food intake, there's different healthy lifestyle, and this can lead to diabetes and hypertension. Now, we have been traumatized by the COVID, especially with healthcare staff, which were in England or in Uganda, because we are in the front line, and this has been very spread. Risks even higher. People were in care homes.
So we are losing you.
Yeah. So,
your volume.
Yeah. So the during and after COVID-19, risk of post-traumatic stress disorder, debrief, and therapy. Is that all right?
Go ahead.
Yeah.
Go ahead.
Yeah. So during COVID, there have been a lot of problems with frontline care workers because it's now being compared to the ones who have been at war. During the war, people who are soldiers who are faced, when they came back, they were diagnosed with post-traumatic stress disorder. And we are fearing that this might happen to the, our frontline care workers. So we need to watch out for that and with our colleagues so that we are able to debrief them and offer them therapy at the earliest opportunity. Now, I'm also involved in training of medical students, postgraduate doctors, training and nurses, training to boost recruitment and retention. Because of the COVID, there's been a lot of problems with recruitment. So we are adjusting our training to improve recruitment. So another one which I'm involved in is training of nursing, because it's a new university now at Kent. It's a brand new medical school for medical students and also for nurses. And the scheme is trying to train nurses at the same level as doctors for the training, and then they can specialize later. So this is quite new and quite, and I'm very enthusiastic about that. Because especially nursing, when the training, they used to have a stopping level because of the type of training they got. So they find they can't get after doctor's level and above. But now, because of this new training, they can be able to be promoted at par with doctors. Now, there's hope about the vaccine. There's a lot of underdevelopment, and there are high hope for their success. Well, this is good news because of the there's so many virus vaccines now for COVID, which are being tested, and hopefully that we have one in mainstream by end of this year or early next year. So that is good hope for people with fearing COVID. But at the moment, We need to still continue social distancing, face mask and hand cleaning, keeping a healthy lifestyle. Now, this is just sort of information. Now, the take-home points from this talk are: one, there's good anxiety and bad anxiety. So good anxiety, get us working, get us performing, good for our health. But the second one is we need now to be aware of our mental health, or your mental health. You need to be aware of that. Now, secondly, there are self-help tools where you can do an MOT, you can do your own assessment, and then you can refer yourself for help where needed. Number three, there are contacts where you can get help from the website. Whether in England or in Uganda, there are contacts. Number four, stigma, which we need to fight it, because stigma can cause isolation, make people not ask for help, delay treatment, and not complying with medication or treatment. And the last one, and most importantly also, is ask for spiritual help from the clergy. So I need to thank the Diaspora Health Strengthening Partnership and the Bobby Welfare Association for inviting me for this talk. Now, before I finish, we need to remember Dr. Luquia, Matthew Luquia, who died from Ebola from the Shaw Hospital many years ago. So he's one of the few colleagues who died in the front line. But also recently now, we need to remember our colleagues who died here in England or United Kingdom and at home, and also remember all who have died because of COVID. But also need to thank all who attended today, and thank you very much. So I'll hand you back now to the moderator, Dr. Julie.